Good morning, everybody. Today is Tuesday, June the 13th. I'm Dr. Sanders, and this is Western Healthcare Exposed. Today, I thought we could talk about chronic pain medications. Anybody out there seen Dope Sick on Hulu? Anybody? Show of hands. Well, that is a documentary on the OxyContin epidemic that hit in Appalachia back in late 1990s, early 2000s. And it was started in Abingdon, Virginia, which is very close to where we are right now. I did several of my medical school and residency rotations there in that town. But anyway, that is a documentary that describes the Sackler family, the big pharma family, and their development of the pain medication OxyContin. So as this drug was being developed, they noticed that people were requiring more and more pain medication because the patient's pain wasn't controlled. And so they came up with this fake term called pseudo addiction. And they started spreading that around to all the doctors in the area and saying, no, the patient really does need more medicine. This is not a real addiction. It is a pseudo addiction. And then as the weeks and months, years went on, the hospitals now have developed a what's called a pain scale, and that is now termed the fifth vital sign. So when you go into a hospital or a doctor's office, you have your blood pressure taken, your pulse, respiratory rate, temperature, and your oxygen saturation, which I know that's 5, so I'm not real sure where they get pain being the fifth vital sign. But anyway, they are now doing a pain scale, wanting to know what your pain level is on a scale of 0 to 10. And if you can't understand that or read, they show you a bunch of smiley faces and frowny faces for you to pick how bad your pain is. And that is now a requirement by the insurance companies for you to get reimbursed, that you have to do a pain scale. And anyway, what they have not told you is that as you increase your pain medication, your pain actually gets worse. There's multiple studies out there that point to pain getting worse as you increase pain medication. All you're doing by increasing the dose is increasing your addiction. So what happens usually is someone has an injury from a car wreck or maybe a coal mining accident or something like that, and they get put on a pain medication. Maybe they start off with some NSAIDs like ibuprofen or something, and the pain's not controlled. So then they go back to their doctor and they're put on Ultram or something like that. And then maybe they advance on to Lortabs or Vicodin. And then it goes to Percocet, and pretty soon taking 5 milligrams of Percocet 3 or 4 times a day is not helping. So then you're at 7.5, 10 milligrams. And before you know it, you're off Percocet and on to OxyContin or oxycodone, immediate release. And then maybe you get on to morphine, maybe you have Dilaudid, maybe you're on to fentanyl suckers and fentanyl patches. And your pain's not getting any better. It's just getting worse and worse. And every time you go to the doctor, you have to have your pain medicine increased. Well, that is because pain medications do not work for chronic pain. They are meant for acute pain, like when you break a bone or something like that. You take it for a few days and then you're off of it. But that is not what has happened in healthcare over the last 20, 25 years. We have got people put on chronic pain medications for life. And that has caused a multitude of problems, including addiction. There are other ways to control pain. There's nutritional supplements, exercise, chiropractic care, osteopathic care, other things aside from taking chronic pain medications. And we may do another episode on what to do to help control chronic pain at some point. And we're also going to do a episode on all these things that hospitals are doing, like these Press-Ganey scores and these pain scales and all, that are tied to your reimbursement that actually have nothing to do with patient care. So anyway, I know this is a little bit shorter of an episode, but I just wanted to let everybody know that taking chronic pain medications actually makes your pain worse, and that is not something that is told in the general healthcare practice of most people. But anyway, I hope this was helpful. Again, if y'all have questions, comments, please leave them. and I will try to answer them. If you have any topics you would like to hear about, leave those as well. I will try to get to those. And I hope y'all have a good day, and I will see you next time.